Good morning. I am Professor Manjari Tripathi. I am Head of Department of Neurology at AIIMS Delhi, and today we will be discussing about women who have epilepsy. About 1.5 million women have epilepsy and are of childbearing age. 0.5% of the pregnancies worldwide constitute women with epilepsy. About a third of women with epilepsy will have an increase in their seizures during pregnancy. Majority of women with epilepsy have unplanned pregnancies, particularly so in India. However, it is heartening to know that 95% of pregnancies are safe in women with epilepsy, provided the neurologist and the obstetrician work together for good outcomes. The first point to remember in a young woman with epilepsy is to choose the correct antiseizure medicine for the young lady. There are certain medicines which are safer than the others. The safer medications are invariably the newer antiseizure medicines. As of now, the safer medicines for generalized seizures as well as focal seizures or seizures of unknown onset which are safe in pregnancy is levetiracetam, lamotrigine, which are probably safer than the others, and for focal seizures, carbamazepine, oxcarbamazepine, lamotrigine as well as levetiracetam can be used. Now, it is very important to remember that these medicines have to be started before pregnancy or right when the girl child is of childbearing age. So, around puberty and 15 to 20 years of age, appropriate medication change must be made even before marriage and even before contemplating pregnancy. Hence, the drug of choice for women with epilepsy before their marriageable age, when they are in their teens, should be levetiracetam in case of generalized seizures and lamotrigine. But do not use too much of lamotrigine when there is associated myoclonus, because we know lamotrigine can worsen the myoclonus. The drug of choice for focal seizures before they get married would be oxcarbamazepine or carbamazepine. It is very important to remember to up-titrate the doses to the maximum tolerated doses, and once they are married and contemplating pregnancy, an optimum dose of these medicines should be used, because as I said, 30% of women will have worsening of seizures during pregnancy. Along with this, any girl who is getting married should be added on to folic acid and other multivitamins. This is because folic acid, along with the anti-epilepsy medication or anti-seizure medicine, will be responsible for preventing fetal neural tube defects as well as associated with better cognitive outcomes in children who are born of mothers with anti-seizure medicine. So, addition of folic acid protects the cognition of the child too and results in better IQs in the child when born. It is very essential to remember that valproate, which is a very good drug and controls almost all kind of seizures, particularly generalized seizures, myoclonic seizures and absence seizures, which is a drug of choice for generalized epilepsies, is not to be used in women with epilepsy as a first line. In fact, valproate has to be reserved for those women who do not respond to other anti-seizure medicines like levetiracetam and lamotrigine. If we are forced to use valproate in young women who are contemplating pregnancy, make sure that you use it in the lowest efficacious doses, well below 600 milligram per day. So 200 BD dose or 300 BD dose of the controlled release preparation would be good in those women who are not responding to a good dose of levetiracetam or lamotrigine or the other drugs for generalized epilepsies. So valproate is not to be used in women with epilepsy, even in young girls who are contemplating marriage. The other reason valproate should not be used is that in young women, it increases weight gain, it causes hair loss, it causes tremors, it causes hirsutism, it causes menstrual irregularities and increased menstrual bleeding. Hence, most women would decline to use it. Also, if valproate is given in high doses, the rate of malformations are very high. So, valproate given to the tune of 600 to 1200 or 1500 milligram results in a chance of 5 to 10% malformation rate. Valproate used in pregnancy also results in lower IQs in the born child, as well as a result in autism and ADHD spectrum disorder. Hence, valproate again has to be restricted to only those girls who are not responding to any other medication, though it is a good drug. Now, coming to levetiracetam, we know we use it, we increase it slowly to 40 milligrams per kg, and the side effect of levetiracetam is of course increased irritability and aggression. So, you have to ask this history in all women, whether they are getting depressed or aggressive, and down titrate if need be, vis-a-vis seizure control. The malformation risk with levetiracetam ranges from 2 to 3%. Hence, it is pretty safe. It is safer than valproate, and it is safer than most other antiseizure medicines. Now, the peculiarity about levetiracetam is in pregnancy, around the third trimester, the levels of levetiracetam drop drastically. So, you may have to increase the dose of levetiracetam in the third trimester beginning, so that the resultant decrease in dose does not result in seizures. So, let us move to lamotrigine. Lamotrigine is a very good drug in women. It has minimal side effects on pregnancy in terms of malformation. Its dose is 5 milligram per kg, and it should be started well before contemplating pregnancy. The only drawback of lamotrigine is that it does not work so well for the myoclonic seizures. Hence, if the patient is having lots of myoclonic seizures, due to which she is likely to drop the child when it is born, lamotrigine may not be a wise choice. Lamotrigine again is associated with lower malformation risks to the tune of 2.5 to 5% as compared to valproate, which can go as high as 10%. The side effect with lamotrigine is of course rash, and because of which we have to up titrate it very slowly, 25 milligram per week, till it reaches 5 milligram per kg. Again, in the third trimester, there is a 70 to 80% drop in lamotrigine levels in the serum of the pregnant woman, and this results in breakthrough seizures. Hence, it is very important that we have to increase the lamotrigine dose to about 8 to 10 milligrams per kg in the last trimester, and this can be rapidly reduced after the child is born. Now, for focal seizures, the drug of choice is either oxcarbamazepine or carbamazepine. With oxcarbamazepine, the dose is 15 to 30 milligram per kg, and with carbamazepine, it is 10 to 20 milligram per kg. And this has to be started much before for focal seizures when the lady is contemplating pregnancy. Now, we may have to increase the dose again, not to the tune of very high levels in the third trimester, because these levels also do reduce in the third trimester. The side effects are weight gain, hypothyroidism, increase in cholesterol levels, and decrease in WBC count. Hence, it is very important that we monitor these throughout pregnancy along with the drug levels. It's very important to understand that the woman is counseled before contemplating pregnancy to the fact that the medicine should not be stopped because breakthrough seizures can result in a stillbirth or can result in an abortion and also maternal death. It's also very important not to create fear in the woman with epilepsy, saying that she can never be pregnant, because we know with the appropriately chosen antiseizure medication, 95% of the pregnancies are safe. Hence, it's very important that the neurologist takes the onus of counseling a woman with epilepsy. It's very essential that they do timely investigations. Around 12 to 14 weeks, a serum alpha fetoprotein has to be done. Around 16 to 18 weeks, a level 2 ultrasound, which is again repeated at 20 weeks, has to be done. If any anomaly is picked up, counseling of the family has to be done, and a choice should be given to the family to what to do with the unborn child. As we know now that the period of medical termination of pregnancy has been extended to 30 weeks, and at some times with special consent of the doctor as well as the patient beyond that. It's very essential that along with the medication, we prescribe folic acid as well as calcium beyond the second and third trimester, but the folic acid has to come even before pregnancy. It's very essential to remind ourselves that women with epilepsy form an important part of our families, and if we can take care of them well, they can take care of their families, and this will result in happier families and happier children and a good outcome for babies born of such mothers. It's also very important to counsel the women socially when they are getting married and even before they are pregnant, in terms of every woman with epilepsy should have some occupation, should be knowing how to fend for herself by an appropriate education and employment. This counseling has to be done by the neurologist even before marriage. They can be teachers, they can be beauticians, they can have their parlors and boutiques, they can be doctors, but they must be on appropriate medicine and must not lose heart. This is because epilepsy in women attracts huge stigma, because of which young women get into depression, and often there is a separation from the husband in their families. So, along with the medical aspects, one must take care of the social aspects. So, let us discuss briefly other drugs which we have been using. Phenytoin is definitely not to be used in women with epilepsy, nor phenobarbital. Restrict the use of valproate to highly exquisitely sensitive women who respond only to valproate in doses lower than 600 milligram. Zonisamide can be used, particularly if the patient is not responding to any other medicines. The pregnancy outcomes are not that bad. Lacosamide can be used. The pregnancy outcomes are only with very few pregnancies, but again there is some malformation rate which needs to be counseled for. So, more or less this is the information about women with epilepsy. Sometimes women with epilepsy can have worsening of seizures around their menstrual cycle. This is known as catamenial epilepsy. Now, catamenial epilepsy can be of three types: C1, which is just before their periods, C2, which is in the peri-ovulatory phase, and C3, which occurs at any time point. For catamenial epilepsy, one can give intermittent clobazam starting 3 to 5 days before their periods and continuing throughout the duration of the periods and then being stopped, or acetazolamide again starting 3 to 5 days before their periods, continuing during their periods and then being stopped. One can also give progesterone tablets or injections. The injections have a longer duration of action in catamenial epilepsy, which is of the C3 kind. It's also important to remember about contraception in women with epilepsy. All young girls who are going to get married should get contraception counseling. For a nulliparous woman, the best contraception would be barrier methods, which the husband has. Apart from that, if they have to use hormonal methods, the safest contraception would be Depo-Provera injections, which is the effect of which lasts for 3 to 6 months, and then repeat injections can be taken. They are available in our country. Estrogen should be avoided because estrogen is a proconvulsant. So, estrogen containing combined pills should be avoided. After the first child, the best contraception method is a copper T. And of course, we should advise them for restricting the number of children to 2, come what may, because increased fertility and increased child birth rate in women with epilepsy will result in poor maternal health. Pregnancy with epilepsy can be safe provided we take timely and appropriate action with adequate dosage of the drugs and appropriately chosen drugs which are optimized before the woman is pregnant. The woman with epilepsy can be safe as well as the child can be safe, and we can avoid both deaths in women with epilepsy as well as stillbirths in children and malformed fetuses if we do so. Thank you.